It is anticipated that a number of prominent professionals from Guyana, as well as from the Pan-American Health Organization (PAHO) and a team from the Global Psychiatric Epidemiology Group, will over the next 4 days make informative presentations on mental health illnesses at the Arthur Chang Conference Center, Liliandale, East Coast, Demerara. During the official launching of the conference, those present were told by CHRISTINA HOVEN, a professor at the Columbia University, one of America's Ivy League institutions, that the purpose of the conference is to celebrate a new day for Guyana as the country embarks on a journey to attack the plague of mental illnesses locally.
And we hope this conference will move us in a new direction. We intend to have this conference annually to examine how well we are doing in moving the country away from having the highest rates of suicide.
In 2014, Guyana topped the world for number of suicides committed, with a whopping 44.2 suicides per 100,000 people, at a time when the global average was 16 suicides per 100,000 people. Since then, a number of programs were rolled out by the local Ministry of Health with the intention of tackling the high incidence of suicide in the country. But despite those interventions, Guyana remains at the top of the world list for suicides committed and is now ranked at number 2. The overall objective of the study is to provide aid and assistance to the relative stakeholders in the formulation of interventions that are applicable to Guyana's culture and other situations, Professor HOVEN said. Meanwhile, Minister of Health Dr. Frank Anthony expressed optimism that this particular conference will set a standard for future conferences. It was then conveyed that the upcoming study will provide Guyana with an accurate overview of the suicide rates, since data collection has always been a problematic exercise.
That in some regions we are probably a little bit better in collecting data than others. And so we can see more cases in some areas, while in others, because we perhaps are not collecting the data.
In 2019, the Ministry of Health reported that Guyana's suicide rate was 40.30 deaths per 100,000 persons, a 2.03% increase from 2018. However, no new information were released by the ministry with regards to the country's suicide rate since then. Taking cognizance of this challenge, it is expected that this specific study will pave the way for a more responsive plan to tackling mental health challenges in Guyana.
This particular department of Columbia University, you're bringing epidemiology and psychiatry, which is something totally new for us. We have been doing it more intuitively, but this is something totally new for us. And we would really like to learn from you.
The study will involve the collection of qualitative data from Guyanese across the 10 administrative regions and will not only focus on Guyana's suicide rates, but it will seek to discover the reasons Guyanese, especially the youths, continue to attempt and commit suicide. So far, information revealed by Professor HOVEN on Monday showed that as it pertains to religion and suicide, 50% of the persons who committed suicide in 2020 were from the Hindu religious faith. More so, 81% of the deaths were males, predominantly of East Indian descent. It was further disclosed that 58% of suicides were committed via the ingestion of poisonous substances. For the HDP 90 News, Kendell Richmond.